Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video clip, I'll be talking to you about a very common condition called deep vein thrombosis. What is it and how important it is for us to recognize it? And we'll talk about subsequently at a later time what are the imaging techniques and how do we treat it, etc., etc. That comes down the line. But let's understand first what DVT is, as commonly it is known as deep vein thrombosis. Well, we have arteries that are sending blood away from the heart, taking blood away from the heart, and veins are bringing blood back to the heart. So that's the distinction between the arteries and veins. Arteries carry pulsatile flow, that means a high velocity flow. Veins carry flow which are more passive, and it's basically returning back blood towards the heart. From the lower extremities, it's working against gravity, as you see, and this being the leg, the thigh and the distal leg, the veins are carrying deoxygenated blood from the two lower extremities, then into your lower pelvis or lower tummy, and then via the inferior vena cava, they pour into the right atrium, as you see in this schematic. The brain vessels, or the veins, or the jugular veins, they're returning blood back via the superior vena cava into the right atrium. So the deoxygenated blood is all arriving into the right side of the heart, the right atrium or the right ventricle. And then right ventricle sends it up to the pulmonary artery, and that takes it to the lungs on either side, situated within the chest for oxygenation. So this way the oxygen is imbibed or actively taken up by the red cells within the blood, and carbon dioxide is rendered to the lungs for exhalation and for getting rid of. And then finally the oxygenated blood arrives back into the left atrium, then down to the left ventricle, and it's pumped into the aorta to the rest of the body for oxygen use. So that's in a nutshell how the circulation goes. So the right side contains deoxygenated blood, therefore it is shown as blue, and the red is all arterial blood, which is oxygenated blood, if you will. So speaking about what makes this deep vein thrombosis occur, well, it's basically the deep veins that bring blood from the lower extremities back to the heart. They're prone for clots. And it's very dangerous because sometimes these clots can migrate. They could be here, they could be here, they could be in the thigh, they could be behind the calves, etc., etc. And these clots can start migrating, and as they migrate, go up to the tummy, they finally find their ways through the inferior vena cava into the right atrium. Once they're in the right atrium, obviously the heart is a dynamic structure or dynamic organ, so the right atrium sends it to the right ventricle, and boom, it goes through this pulmonary artery into the lungs. And that becomes a very, very serious or critical condition, because now you have a clot in the lung, which implies it's a very, very serious or critical condition. What makes you prone to have DVT or deep vein thrombosis? Well, prolonged immobilization. So let's start with something which is very commonly seen in prolonged hospitalization in patients or at nursing homes, elderly people who are at nursing homes. If they're not being turned in bed that often, or there is some condition that requires them to be hospitalized for a long time, like critically ill patients in the ICU, patients who have low flow, that means they have a low output failure or congestive heart failure, so the blood is going very, very sluggishly. Hypercoagulable states, that means the blood contains certain factors. Remember, we are constantly bleeding and coagulating within the bloodstream. That's a very interesting aspect. We'll talk about that at a later time. But we have a balance so that we neither bleed nor we coagulate, and the blood moves in that fluid condition throughout the arterial and the venous system. But conditions which are prone for hypercoagulability, like excess of factors, certain factors like 2, 9, and 11, or deficiencies of protein S and C deficiencies, we call them, or during pregnancy. Pregnancy, obviously, there is more hypercoagulable states and the venous flow is reduced because of the gravid uterus, because the baby is in the tummy. So the flow is reduced or becomes slower in the veins. Oral contraceptives, use of oral contraceptives makes it hypercoagulable state in the blood. Certain malignancies will do that. Antiphospholipid syndromes are very unfortunately notorious about that. And smoking. Smoking also makes the blood a little more thick or hypercoagulable. And so all of these are predisposing risk factors which make a person prone for DVT. Hope you found this interesting. Let's talk about how do we diagnose and what the treatments will be in the subsequent presentations. Thank you.